Hi everyone, thank you very much for opting to watch the video component of this assessment briefing. Now this is just a short video that's going to really just discuss the importance as to why this assessment is relevant to yourself. So really, what we have to think about first is what assessment has actually been designed for yourself. So Assessment 1 is what we will be focusing on today. Assessment 1 is made up of two components, Component 1 and Component 2. Component 1 is an OSCE and Component 2 is a multiple choice questions exam. So what we need to ask ourselves is, why has a specific assessment been designed for you? Well, really, the aim of this assessment is for you to really demonstrate to us that you have the basic foundations for you to be able to progress onto the next modules within your course. This module itself is very, very basic. It's setting the foundations for you to build up your knowledge and your understanding and your clinical experience to the next modules. Now really, we have to start at basics, and the basics for you at this stage is for you to be able to understand what the basic etiology of any oral conditions associated with plaque bacteria is. So you must be able to demonstrate to us that you have that knowledge and you are able to apply that to us so that we know that you are ready to move on to the next level of your modules. So really, you might be thinking, well, what am I getting out of this actual assessment? What's in it for me by sitting this assessment? And that's relatively straightforward. Really, what you should be thinking is, well, by passing this module, it's enabling me to actually move on to other modules, because remember, we need all these modules to be passed in order for you to qualify to move on to the next year of your studies. So what you should be thinking about is, what are you getting out of this assessment? And really, you're getting out the understanding as to what plaque biofilm is. What happens when you leave that plaque biofilm? What happens if I don't know anything about that plaque biofilm and I'm just treating other conditions, not really having the understanding of what plaque biofilm is? Also, within the module, there's a huge practical component. And in part of this module, we focus on things like cross-contamination, the basics of drugs that are associated with you as a qualified dental therapist. These are really setting up the foundations for you to understand, well, why do you use local anesthetic while you're doing plaque prophylaxis? What happens if you do not use local anesthetic if you perform plaque biofilm prophylaxis? Or in the worst case scenario, what happens if you do not actually perform adequate infection control, which is something that is of paramount in your career as a dental therapist? Thank you very much for watching this video. I really wish you all the success when sitting this assessment.